Are you feeling that twinge in your shoulder every time you pull the milk out of the fridge? Or maybe you can't exercise or play sports the same way due to persistent shoulder pain. Hey, don't let that pain keep you on the sidelines or from enjoying daily life. Modern shoulder replacement surgery is helping patients reclaim their range of motion and strength. And Dr. Mathew Kolevar from Trinity Health is joining us now to discuss how surgeons can customize implants to fit a patient's unique anatomy, treating everything from severe arthritis to rotator cuff. Wow, that's amazing, doctor. Thanks for being here.
Yeah, thanks for having me.
Absolutely. I mean, let's talk about, it sounds huge. What is shoulder replacement surgery?
Yeah, so a shoulder replacement is similar to a hip or a knee replacement surgery, where we cut out the diseased parts of the shoulder, replace them with precisely engineered metal and plastic components. This is a great option for pain relief, increasing function, increasing quality of life in patients who have severe osteoarthritis, chronic tears with the rotator cuff, or other shoulder pathology.
Yeah, I guess who would be coming in then for a shoulder replacement? I mean, I've had a shot myself, for shoulder pain, but shoulder replacement surgery, who's getting that?
Yeah, so it's a lot of patients who have a lot of stiffness in the shoulder from the arthritis. They have a lot of weakness from a chronic rotator cuff tear that can't be repaired. It's patients who can't put stuff on the shelf. They can't get the gallon of milk out of the fridge, things like that. Stuff that really affects their quality of life.
Absolutely. So how does this work? I know that a lot of ortho surgeries are kind of outpatient. This doesn't sound like an outpatient one.
It is actually. A lot of shoulder replacements are outpatient. Patients go home the same day, typically with a sling. They're in a sling for about 6 weeks or less. They can go back to their activities pretty quickly.
That's amazing. 6 weeks or less. Now, let's talk safety, right? Because a lot of people worry going under the knife.
Yeah. It's a big surgery, but it's a very safe surgery. It's performed commonly across the United States. It has very good, reliable outcomes and a strong safety profile.
And I got to assume that there's got to be some physical therapy after the surgery. An outpatient surgery, you're right, in and out in one day, but then the real work begins, right?
Yeah, physical therapy at home with home exercises or with the physical therapist in person. Both have been proven to have great outcomes after surgery.
Well, let's talk about Trinity Health's expertise and why someone might want to choose Trinity Health if they're looking for a shoulder replacement.
Yeah, Trinity Health is a great option for all patients with shoulder issues. We have multiple surgeons with extensive training in shoulder replacement surgery. We use the latest surgical techniques, including 3D imaging and navigation software, to put implants in the precise location for each individual patient. And we have a multidisciplinary team consisting of surgeons, nurses who are experienced with taking care of shoulder replacement patients before and after surgery, and highly trained anesthesiologists that are familiar with shoulder replacement and the nuances therefore.
Wow, you guys have got the entire gamut of everyone there. All the expertise is waiting for you, and those appointments, if you want to call, sometimes same day. Something next day. You can get in that appointment today. You want to do that? You should probably start here. TrinityHealthMI.org/joint pain for more information.